Okay, we're going to start in a half a minute. Okay, if I can ask the host to please record the talk as of now. So good luck, everybody. I hope everybody had a wonderful Shabbos. We did Rosh Chodesh benching, Shabbos Mevorachim for Rosh Chodesh Elul. Elul is a very important time in the Jewish calendar. And I gave a small drasha in shul this morning, which I apologize. I'm going to repeat some of it now because I think it's a very important message, but just briefly. As we probably saw in the CDC this week, for those that look at those things, the CDC noted that there is a significant increase in mental health issues stemming from COVID and from this time that we're in with isolation, with distancing, with change in schedules, economic difficulties, people going through medical serious difficulties, illness, death in families. And the CDC has noted this is a major problem. And as we go into Chodesh Elul, when we obviously start thinking about ourselves, our families, Klal Yisrael, and the entire state of the world. So this is a great opportunity for us to think how we can make things better. And I brought down a famous idea from the Motzei Ephraim. The Motzei Ephraim says at the start of Chodesh Elul, starting from this Friday with Aleph Elul, he suggests that every single person in Klal Yisrael say 10 kapitlach Tehillim every day. This way you go through Tehillim twice during Chodesh Elul, which the gematria of the 300 times that you'll be saying the various kapitlach of Tehillim, each kapitel saying twice, 150 kapitlach. So that would be 300, which is the gematria of kaper, which means HaKadosh Baruch Hu, please give us an atonement. And during this difficult time, we have to think about ourselves. We have to think about our community, about Klal Yisrael. What better way than for a person to commit and do something special? Each of us, as we hit Chodesh Elul, should be trying to think how we can be better people and what we can do for Klal Yisrael. And what a great way, no matter what your background is, no matter how well you can understand the Tehillim, just the saying of Tehillim every day. If we follow the wonderful advice of the great Motzei Ephraim, Ephraim Margolius Zatzal, the great author of the Motzei Ephraim, which is the major sefer, one of the major svarim on the Yomim Noraim, the halachos of Rosh Hashanah, Yom Kippur, and Sukkot. So it would be a tremendous idea if everybody followed his advice and said 10 kapitlach of Tehillim, 10 chapters of Tehillim every day, and you set aside a time to do this so that you don't forget and get into this routine. It's a wonderful routine for people to do all year long, to say Tehillim every day for Klal Yisrael and for personal needs that they have. And the Motzei Ephraim is a wonderful source for this custom, and strongly recommend that people take upon themselves to follow the custom this year. And Be'ezus Hashem, with the saying of all the Tehillim that all of Klal Yisrael will do, all the people that follow this beautiful idea of the Motzei Ephraim, it should be a zechus for all of Klal Yisrael, a zechus to get us away from COVID and to be able to focus on the Yomim Noraim instead of focusing on COVID in the Yomim Noraim. There are a lot of things this week that I wanted to talk about. First of all, I thank all the people that asked me, they enjoyed the articles that I send out, the letter that I sent out. I just haven't had the time in the last 2 weeks. I will be, Be'ezus Hashem, try to still do it when I can. And these opportunities for us talking about it, I'll try to pick up tonight, and some new things that went on this week in the world of COVID. So the first and most important thing is vaccinations. So the CDC has come out with guidelines for influenza vaccinations. I'll talk about COVID vaccinations in a moment, but the influenza vaccinations are very, very important this year, more so than ever. And I ask people who maybe have been reluctant to get vaccinated in the past to influenza to please get vaccinated this year. It is a safe vaccine. It is a good vaccine. It will be extremely important to have less viral illnesses that could be masquerading and looking like COVID. Because Rahman al-Itzlan, if the emergency rooms are busy, if doctors' offices are busy, and they have to deal with not only COVID, but they have to deal with influenza, it's just going to make things that much more difficult. It will stress testing that much more. Testing has always been not the simplest thing to do. It will make that many more tests need to be done. And there's obviously the serious complications. Flu is a fatal illness itself. And I stress and implore people who maybe have been on the fence about taking the flu vaccine in previous years to please go and do so. Interestingly, there was a study that suggested that people who've had flu vaccinations actually had a lower problem with COVID than those that did not get flu vaccination. Now, that's not to suggest that influenza vaccine in any way is a replacement for a COVID vaccine, but it was interesting that there may be some protective benefit from other vaccinations towards people getting more serious complications with COVID. There were more studies published this week showing, Be'ezus Hashem, the still good going progress in terms of a COVID vaccine. And Be'ezus Hashem, we will hopefully be starting as one of sites for New York City. There'll be other sites as well, different medical centers. But at Mount Sinai South Nasa, Be'ezus Hashem, we will be having a COVID vaccine trial, participating with the Mount Sinai network, and more details to come on that. But Be'ezus Hashem, that is going forward, and we'll probably start looking for volunteers to participate in September. There'll be other studies as well. Don't mean to single out only our site, but Be'ezus Hashem, that will be up and coming in September. I wanted to talk about, there's a lot of press about the Russian vaccine, Israel trying the Russian vaccine, China, Pakistan, other places trying the Russian vaccine. At this point in time, none of those vaccines have undergone phase 3 studies. Those phase 3 studies are already in place and are underway in the United States for many different vaccines. And I certainly would not encourage anybody outside of a study setting to go and take any vaccine to prevent COVID at this point in time. Now, Be'ezus Hashem, those vaccines will be fine. I'm not saying that they're not fine. I just wouldn't encourage mass vaccination outside of a study setting of any vaccine at this point in time because of the A, potential dangers, but B, the inability to say, did the vaccine work or not? And part of the trials are to assure that the vaccine not only is safe, but that it actually works and that it's worthwhile to go and distribute 300 million doses in the United States, at least in theory, and across the world, billions of doses. So you really want to assume that it works before you go. You want to prove that it works before you would just assume that it does and give it out to everybody. So that's all I want to say about vaccines. There's more that will be coming in the upcoming weeks as studies go further in the phase 3 trials, and Be'ezus Hashem, it can get an FDA emergency use authorization, maybe even before the end of this year, although more likely most people will actually only be able to get it if it does get that authorization in early 2021. The question about masks is one of the most common questions that I get. So I wanted to talk a little bit about the details of masks. There was a paper that was published that did suggest that there are differences between the masks. And at this point, my recommendation is as follows. And this is what the CDC recommends too for some of the things that I'm going to say. Others, the CDC doesn't have a specific statement. I think at this point in time, other than for healthcare workers who are treating a patient with known active COVID, where they have different standards, but a typical appropriate prevention of getting COVID in a routine health, non-healthcare people would be that you should wear either a 3-ply surgical mask. Those are the standard masks, the white and blue standard surgical masks, which are pretty available in stores and on the internet and aren't very expensive. And that would be my preferred choice for people. Or alternatively, as a second, slightly less preferred choice, would be a cloth mask, a facial mask that has a 3-ply cloth material. Those are probably the two best things. The CDC came out with something that we've spoken about beforehand, that you should absolutely not be wearing a vented mask. Those are the masks that have a circle on them, usually to the side, where you can intake air, but that is filtered. But when you go out, the air is not filtered, and it's your regular air. And your air that goes out is the reason why you wear a mask, so you don't potentially get someone else infected. As we tell people, you're wearing the mask for other people, not for yourself, although it does have benefit for yourself. But the main reason why we recommend that everybody wear a mask is to protect other people. You're wearing the mask for me, and I'm wearing the mask for you. And therefore, a vented mask that allows only air that comes in to be filtered, but the air that comes out is not filtered. That's good for a construction site. We don't care what you're putting out of the air. You just don't want the dirt, the particles coming in. But it's terrible for COVID. So we follow in our hospital that advice. The CDC officially came out and recommended against vented masks. And I would suggest that every shul have a policy. And Baruch Hashem, I don't see too many vented masks around. I think people have gotten this message, but nobody should be coming to shul with a vented mask. I don't think people should be wearing a vented mask at all. What about the bandanas or the gaiters or the scarves? So this study suggested that they are less effective. And therefore, I would also at this point recommend that people not wear those unless they absolutely have no other choice. They're stuck someplace and that's the only thing that they have. But to come to shul, to come to public places, it is recommended that you not wear those gaiters, that you not wear those bandanas, but you should wear either a surgical mask, which are almost all 3-ply, or a cloth mask, preferably that's 3-ply. And that's the best recommendation at this point. No vented masks. And people do not need to wear the N95s or the KN95s unless they're healthcare workers. And that leads to a question that I get asked a lot in terms about face shields. Now, I do not recommend routinely the wearing of face shields outside of a hospital setting. In a hospital setting, we do insist that when seeing patients, all the healthcare workers in the hospital wear either eye protection in the form of goggles or some sort of an eye shield, or just wear the full face shield. It's sometimes easier with a mask. It's not instead of a mask, but that's when you're dealing with patients. In the routine setting, when both you and the other person are masked, which is the way it should be. So I do not recommend and do not think it's necessary to wear any sort of eye protection. The one exception to that may be, and this is a question that a lot of people have asked, I saw in the chat already beforehand, as well as I get a lot of questions about this, is what about teachers? So teachers in higher grades where the children will also be wearing a mask. So I don't think the teachers necessarily need to wear eye shields, goggles, or eye protection. However, for teachers taking care of younger students in a preschool and a younger grade where the children aren't wearing masks, I think it's a reasonable thing that a teacher, of course, always mask, but to also wear some sort of eye protection, either goggles or a face shield, because they're going to be encountering lots of young children. These are toddlers. These are young children. You're going to need to be near them. You can't stand behind a partition the whole day and teach a lecture. These are children. They're going to be playing and fighting and all the activities that we love, Baruch Hashem, to see our children do. And that's close contact and it needs close supervision. So I would recommend in that situation that people wear eye protection as well as a mask, not instead of. I want to stress that, not instead of. I'll take more questions about that later on. I'll talk a little bit more about schools later on as well. I have to mention one thing because it's very disappointing. I've mentioned this in the past. I can't understand why people don't wear masks. I don't understand it. I accept that not everybody's going to listen to me. I accept that not everybody's going to listen to the CDC and the experts, and people make personal choices. I understand that. I don't agree with it. I don't recommend it. I'm not condoning it, but I understand it to a certain extent. What I don't understand and what I find extremely, extremely wrong is to encourage other people not to wear a mask. That is lanias dati, with my humble opinion. That's rishus. That's outright wrong. That's outright evil. To be happy and to encourage other people not to wear a mask. It's bad enough if you make a personal decision for yourself not to wear a mask. I strongly disagree with it. The medical advice of the experts, the poskim that I speak with and follow, they all say you must wear a mask. So if an individual chooses not to, they're breaching appropriate halachic and medical advice. That's an individual decision. The people that machal shabbos, the people that do other averos, I try not to do them. I'm over them myself sometimes. I do the best that I can. I expect everybody wants to do the best that they can as well. But to encourage other people to be machal shabbos, that's rishus. To encourage people that are wearing a mask to take it off and not to wear it, and to put on your Facebook page or other social media, I got somebody else not to wear a mask, or I was able to break the rules again. So lanias dati, that's rishus. And people that do that and publicize it and are proud of it. So I don't understand it. I don't want to call out people by name. I don't want to make this into a war. If you don't want to wear a mask, okay, don't wear a mask. I can't do anything about it. We have policies in schools, we have policies in stores, there are government policies, but to encourage or try to get other people not to wear a mask, that there's just no explanation for. And that lanias dati is rishus, it's evilness, and it should be stopped. And it shouldn't, certainly people that advocate that, it's just wrong, just wrong. In terms of situations with the Yom Noraim and mask wearing, I'll talk about that in a moment. Before I get to that, just a couple of things that there were major articles about that I wanted to make sure people are aware of, in terms of some studies suggesting that, again, there's a second case of COVID. So there is one paper now published that may suggest, again, it's not clear that it really was a second case of COVID. And I know some doctors have given me some information, and I will try my best to work with any doctor that has a real case and has detailed cases, and I'll make sure that we do get it published if there is such a case. However, the CDC still states there is no second case of COVID. And now the CDC has even more formally stated what they've said in the past, that nobody has gotten COVID within 3 months after getting COVID. You still may test positive on some of the swabs, but that doesn't mean they're contagious. Another study came out this week suggesting, again, about 8 days is the maximum that people shed virus after they're detected as having virus. So the longer durations of time represent dead virus that we're able to detect because we have very sensitive tests in some ways, and they don't represent contagiousness. And somebody could be negative and then be positive at a later point. That doesn't mean they have a second case. So the CDC now officially states that 90 days, 3 months, nobody has gotten COVID, and they're comfortable with that because we now have a decent amount of experience. However, there are studies, multiple studies, that show that antibody wanes over time. And this is critical because we don't still know what that means, but there is obviously the potential that those patients are losing their immunity. We don't know that. And again, Baruch Hashem, we have not seen cases at 91 days and 4 months and 5 months to any large extent. So b'li ayin hara, it probably, even if your detectable levels of antibody are lower or wane, you still hopefully have immunity, but more time needs to go by before we can say that. Again, having said that, it's wonderful if somebody has antibodies. It's wonderful if somebody, Baruch Hashem, has survived COVID. They are far less likely to get COVID or to transmit COVID. That's for sure. The question is, how long will that last, and is it an absolute? We still don't know the answer. If you had COVID, can you transmit COVID? Even though you may not get sick yourself, that answer still remains unknown, although b'li ayin hara, there isn't evidence that that has occurred. The next thing that I wanted to just mention is there was a major study suggesting that statins are actually somewhat helpful. I mentioned this not because I want people to take statins, but anybody who is taking a statin already, those are used for problems with cholesterol, so they should be reassured that there was some question, are they potentially dangerous? So if anything, the statins are going to be helpful. Not suggesting, please, I'm not suggesting people go take a statin because of this, but at least it looks like a major study came out to suggest that statins are not dangerous. There was a very good study suggesting, again, we've seen this, that Baruch Hashem, the mortality for patients who do get sick and do get hospitalized is better. There are new treatment modalities that seem to be effective. There's a very advanced treatment called ECMO, which is for the very sickest of patients. It seems to be of some benefit in those very, very sick patients. That's, again, our ability to care for patients with COVID is better. So b'li ayin hara, the mortality rates are going down, and b'ezus Hashem, we will hopefully not need that better way to take care of them as we wear masks and prevent cases. Masks have prevented hundreds of thousands of cases of COVID and therefore many, many deaths. Unfortunately, risk factors again were described for vaping and cigarette use. So people that vape are at higher risk of complications from getting COVID, as well as getting sicker from COVID. And that's probably true with cigarette smokers as well. You can't do anything about your past history, but certainly always recommend that people not use cigarettes. That certainly is not going to help you. And clearly it is potentially dangerous if you get COVID and you actively smoke cigarettes. The next thing that I wanted to talk about is I get a lot of questions about the quarantine rules, especially with kids coming back from camp. So I'm very happy to say that I know some camps sent out detailed letters last week explaining what went on in their camps and they did test for COVID. They didn't find COVID. And those children, as I mentioned last week, I actually mentioned several weeks ago, several times. So those children, when they come home from those camps that were really on top of things and actively tested lots of children, so then I don't think those children necessarily need to be quarantined when they come home, and they should be treated like anybody else who is, Baruch Hashem, Bli Ayin Hara, not been exposed to COVID. That's if the camp writes a letter and states that they've done active testing, active surveillance, looking for cases of COVID. Again, where camps did not do that, or you don't know that information, and especially if there is illness in those camps, so then I would strongly recommend that we consider at least an evaluation by the pediatrician, if not actual quarantine, where there is a concern that the children could have had COVID in a camp. The camps aren't providing you the information in terms of COVID testing. The camps aren't providing you information about illness in those camps, or they are saying there was illness, but we didn't test for COVID. So I think those children should certainly be seen by their pediatrician. Testing can be done, but as I pointed out multiple times, testing is really not the way to rule out COVID. A test, if it's negative, doesn't rule out COVID. And therefore, you need the full 14 days of quarantine. I know it's difficult. People don't like to hear that. I got calls this week. I've gotten more calls than I've gotten in a long time about people who tested positive from all sorts of communities, from communities that supposedly have no COVID, bungalow colonies that have no COVID. And I'm getting calls from people saying, yes, there was a simcha, there was this person that came in from out of town, or I was exposed to so-and-so. And yes, there is COVID still around. We, Baruch Hashem, have not seen an increase, but we still have not seen a decrease in COVID in our immediate areas. And there are new cases of COVID. Baruch Hashem, they have not led to major catastrophic outbreaks, but there are cases, and that's why quarantine remains extremely important. Who requires quarantine? A person who has COVID, obviously, and they should be followed with their physician to decide when that quarantine can be over. And anyone exposed to them. Exposed to them means that they weren't wearing a mask and you weren't wearing a mask and you were together for some period of time. Don't know exactly how long that should be, but some period of time. Not that you just walk by them on the street, but you're in the same room with them, within 6 feet of them for a few minutes. And that's an exposure. And therefore, you need to be quarantined. So in putting it in technical terms, you have the Av HaTumah, that's the person with COVID. And the Rishon is the person that's exposed to them. The Rishon, the person exposed to a known COVID case, must be in quarantine for 14 days. I don't care how often they get tested, they need to be in quarantine for 14 days. A negative test doesn't mean anything. It means that right now the test couldn't detect it. They still could have it and the test didn't detect it, or they could get it tomorrow. So they must be in quarantine for 14 days. Their family of the quarantine person, not the COVID person, but the quarantine family, I'll call that the Sheni. So the Rishon, who was exposed to COVID, needs to be in quarantine. The Rishon's family doesn't need to be in quarantine until, if heaven forbid, the family member who was in quarantine turns out to have COVID. So I tell the Shenis, the people that are the family of the person in quarantine who was exposed to COVID, I know it's a little complicated. That's why I need to discuss this with your doctor. Please don't just call me up and tell me some facts and expect me to be able to give you an accurate answer. This is why there are physicians that you should go to detail all the information and get the right answer. But in general, the family should be practicing very strict self-monitoring and masking and distancing. Everybody should, but they absolutely have to, because in retrospect, if it turns out that the family member who was in quarantine does come down with COVID, then they're all going to have to be in quarantine, but they could have been contagious. So if they walk around without a mask, if they walk around without social distancing, they're putting everybody at risk, even though right now they're not supposed to be in quarantine. I know that's complicated. I know it's not easy to understand. Please discuss this with your physician if you have anybody in your family that's in quarantine, or if you've been exposed to anybody. I got an email from somebody in bungalow colony that the whole family was exposed if they wanted to stay in the bungalow colony. You can't do that. That's very, very dangerous. You have to be in quarantine. And if children can't go to camp, if they've been exposed to a COVID case, those people cannot go to camp. They cannot go the rest of the activities because they haven't been positively identified. They're in quarantine. Finally, last few minutes, I want to spend talking a little bit about the Yomim Noraim. because I'm getting a lot of questions from shuls and people across the country. So the Yomim Noraim, every shul is going to have to figure out the best way to do it for themselves. It's not one size fits all. It depends tremendously on what's going on with COVID in your area. In April, if the Yom Noraim were in April, like with Pesach, we canceled public Pesach. So in a place where COVID is rampant, they're not going to be shuls and Yom Noraim in the normal way. But if the incidence is appropriate to have shuls, so then every shul is going to have to figure out a way to maintain the regular masking and social distancing davenings. Outdoors in general is always safer than indoors. But again, if the indoors is appropriate, socially distanced, masked, the filtration systems in the shul are up to date, the engineer, the AC people in the shul are comfortable with it. So then indoor shuls, I think, are fine. The davening will be longer. The general rule is the shorter the davening, the better. We should try not to extend the davening. That doesn't mean necessarily drastic cuts, but each shul has to figure out, and maybe multiple different minyanim in a shul will have it different ways. Maybe there'll be some minyanim will be more of a singing minyan, but they'll cut out some piyutim. Maybe other minyanim will be more just saying each word mila b'mila without the singing. That will allow them to go through the entire davening. Maybe some minyanim will have a combination. There will be many different ways that a shul can do this safely. Each shul, each minyan will have to be done safely with the local professionals providing the best advice possible. I do believe for an indoor minyan that everybody needs to be wearing a mask, including the chazan. There is talk if they're behind the partition, if they're davening in the front of the shul, there's nobody within 12 feet of them. These are somewhat b'di'evitz. Each shul has to make their own decisions. My preferred way would be that the chazan be masked. If it's outdoors and the chazan is in the front of the shul and he's literally 15, 20 feet away from everybody else, so then if he wears a face shield, I think it's probably fine in an outdoor setting. I still think because of the low plug, we don't want to say, well, he's not wearing a mask, I don't have to wear a mask. I think it might be safer for everybody to be wearing a mask. I can understand if it's difficult for a chazan to wear a mask the entire time, and it's an outdoor minyan. For an indoor minyan, I would say they should. But for an outdoor minyan, if he's truly at the front of the minyan and there's nobody in front of him and nobody right to the side of him, I think it's a reasonable thing to just wear a face shield. In terms of shofar blowing, I think that there are minimal data, but some data to suggest that the shofar blowing is not as dangerous as one might have thought. Now, I don't say that lightly, and I don't say that we shouldn't be careful. Having said that, we should be as careful as we possibly can. The poskim, I believe, have said that you can put some sort of a mask or a cover on the end of the shofar that goes out. You can't have it on the part that you're blowing. It can't be any interposition between your lips and the shofar, although you could wear a mask around it, put the shofar underneath the mask, so in case there is a spray coming out of you, the mask would protect it somewhat, but you must blow directly into the shofar. But you could put a mask at the other end. I don't think that that's a problem. The poskim have said it doesn't really change the sound. Or alternatively, to blow into some sort of a partition, or ideally, to blow in a different room. You don't have to be in the same room as the person blowing the shofar to be Motzei. Straightforward Mishnah. I asked this to Rabbi Willik Shlita, and he paskined it 100%. You can be outside. The person blowing the shofar could be like by a side door and could be blowing in a different room. As long as you can hear clearly the kolos, that would be fine. Or to blow all the way up in the front in a corner, to blow into some sort of a material that would somewhat absorb the potential for spread of the virus, to blow outside into a window, or to blow again in a way with as far away from people as possible. All those are preferred. Outside, I think it's less of a problem, but again, the person should be as far away as possible from everybody else. Ideally, if you knew the chazan and or the Baal Tokeya had antibodies or had COVID, that's a wonderful additional benefit. I'm not recommending that we do COVID antibody testing on everybody, but it's a nice additional positive, which you can't rely upon without doing all the other things I said, but it's a nice additional positive if you know that the person blowing the shofar or the person who's the chazan had COVID in the past or had antibodies, because it's very, very unlikely that they will have transmitted in that situation, plus all the precautions that you're doing. Then the final thing I wanted to talk about is schools. Maybe I'll save a lot of that to talk about for next week, because there's still a lot more that needs to be understood and known. Every school, yeshiva, as well as the public schools, are putting together plans. All the yeshivas that I've worked are working unbelievably diligently to try to make it as safe as possible with various uses of masking, social distancing, cohorting, which I think is very important, putting up partitions as possible, and educational instruction. But the most important thing I'll say there, before I open it up to questions, is that parents have to understand that if you send in a child sick to school, you're potentially ruining that entire school and potentially ruining that entire neighborhood, because a sick child in school who has COVID is going to spread it. I think it's safe to say that children can spread COVID, whether it's more or less, different ages, almost irrelevant. And putting a child, especially in the younger grades, together with all the other children unmasked, that will rapidly cause all those children to either get COVID themselves, and bli ein hara, they won't get very sick, but they'll be able to transmit it to their parents, to their grandparents, and everybody else in their bubble, or if they're playing outside with all the other kids that they're playing with outside, or on the school bus that they're traveling with, outside of their cohort, in their carpools, in their shuls that they're going to, and this could be a problem. So parents have to understand that they bear a certain responsibility to make sure that their children don't go to school when they're sick. Is Reb Shmuel on?
Yes.
If you can start with some of the questions, we'll do
Okay.
10 minutes of questions. Thank you.
Okay. First questions relate to weddings. Baruch Hashem, we're having more weddings within the community. And the question was asked whether, if it's a small wedding and it's doable, you recommend that people that are invited to the wedding be tested for COVID prior to attending the wedding. And secondly, when Sheva Brachas comes, is it okay to pass around the kos for Sheva Brachas, or should one person just hold the kos and people should make the Sheva Brachas without holding the kos?
Okay, so this is a very, very important question. I actually wanted to speak about this and I didn't have time, but Baruch Hashem, you brought it up, so it's a great thing. I want to give people my idea of the perfect simcha. The perfect simcha should be done and encouraged. And in fact, Margie tells me with the YU Connects, they're having many programs that they're putting together, and they're trying to resolve many different things in terms of sometimes he's causing tremendous agmas nefesh and fights in couples when they're getting married. So we want everybody to have the perfect simcha. What is the perfect simcha? So there's a famous vart from Yaakov Kamenetsky Zatzal. He was asked, there are two different customs that when we walk our children down the aisle. So there's one custom, more of a Hasidic custom, that both fathers walk the chassan down and both mothers walk the kala down. And then there's probably the more common method in our communities when the father and mother walk their son down and the father and mother walk the daughter down. So they asked Rav Yaakov, what's your custom? What do you recommend? And he said, I follow whatever the mechutin wants, meaning whatever the other side wants, that's what my custom is. What a beautiful thought. That's why he was Rav Yaakov. What a beautiful thought for Shalom Bayis. And people, they get so caught up in the 5 hours of the wedding. It's the least important part of their lives. It's what happens after the wedding. And if you've spoiled that relationship, the in-laws don't get along, and Nebuchadnezzar causes ketata, fighting with the children, the two couples getting married, the couple getting married, and now there's a little bit of a friction there, and it's going to cause a friction with the mechutanim. It's just terrible. And we should be following the general rule of Rav Yaakov, whatever the other side wants. But here, it's dangerous for one side. You have the makel side and the machmir side, the masked side and the unmasked side. So the answer is you always follow the way that will keep everybody happy. If one side says we want Chalav Yisrael and the other side says we don't want Chalav Yisrael, so then you have Chalav Yisrael. One says we want Yashin, the other side says we're not machmir and Yashin. So for the wedding, you have Yashin. You follow the one that will make everybody happy. If one side says, listen, we wear masks, and the other side says, we don't wear masks, there's no COVID in our community. So then you wear masks at the wedding. That's shalom bayis. That's ahavas chinam. That's loving somebody else, not causing a fight. Well, I'm going to not let them wear masks. I saw an invitation that said, don't come if you're wearing a mask. How sad is that? At a wedding, it should be the greatest day of simcha. So the wedding should be in a way that will be protective of everybody with masks and social distancing. I'm very, very much against, at this point, any sort of eating together in public with different people mingling, kiddishes, anything like that. It's dangerous at this point in time. What is acceptable is to have separate tables for every family group that's living together at a wedding or at a Sheva Brachos, and just that family sitting at that table. Then they take off their masks and they eat, but nobody else is near them. They're the people living together. They're eating supper in their house. They can eat supper, especially if it's outdoors together. The food is brought to them as opposed to in a buffet style. Sometimes you can't help it. You have to have a buffet so that everybody's wearing a mask. You have them go in order so they're socially distanced. They bring back the food to the table. Then they can take off the mask. That's a wonderful, beautiful simcha. I've mentioned I've been to some of those. Sometimes it's a grab bag, a grab and go. You wish a mazel tov, and then you go. Wonderful, beautiful, socially distanced, the mask, no problems with the food. The food is the major problem. In regards to making sheva brachos, so there's lots of different ways to do it. One person can hold the kos, and the other people can just make the bracha. That's fine. If you want to be medactic to hold the kos shel bracha where you make the bracha, so then just Purell beforehand and Purell afterwards. Not a big deal. These types of things aren't the way COVID is transmitted. The people that are worried about, we passed each other the Sheva Brachos cup, but they're not worried about everybody eating together at the shmog. So that's a misplaced understanding of how COVID is transmitted.
You mentioned quarantine. Somebody wants to know, what does quarantine exactly mean? Meaning the person that's in quarantine, can that person take a walk around the block, assuming nobody else is around? It's a nice day.
So they can go outside. They should not be within proximity of anybody else. They shouldn't be walking far outside. They should stay near their house. They get some fresh air. They can walk right around their block. In Eretz Yisrael, I think they were keeping them within 100 feet of their apartment, but that's not a din. That's not medically proven. They shouldn't be near anybody else. Now, their own family, they should, if at all possible, if a kid's coming home from camp with a positive COVID test, so ideally, the rest of the family shouldn't be around him. Ideally, he should be in his own room. Ideally, he should have his own bathroom. But certainly, that may not be possible. So then certainly the family members and the person with COVID should be masked at all times. Excuse me. They should be masked at all times, and they should try to distance, ideally in a separate room. That's the safest way. It doesn't mean you can't leave your room. Just don't be leaving your room when other people are around. Doesn't mean you can't go outside, but don't go outside when anybody else is around.
This question constantly comes up, so I'll ask you again. Since there are many communities who are not wearing masks, why don't we see more COVID cases from those communities?
So I wish I knew the answer to that. If we knew the answer to that, we could say they're right or we could say that they're wrong. All I can say is that COVID is still around. And even if some level of herd immunity is present in those communities, which is certainly not present in ours based upon the data that I have from antibody positivity in our neighborhood. So even if there is a certain level of herd immunity, what about the people that aren't immune? Herd immunity will help prevent huge spread, but it won't prevent spread to an individual. If you have somebody's Zaidi going to shul and he sits near somebody who has COVID, who's asymptomatic, all the herd immunity in the world isn't going to prevent Zaidi from getting sick and Rahman al-Islam dying. So maybe it won't spread to a lot of people. But again, I'm telling you, I'm getting calls from places where COVID is gone. I'm getting calls about positive cases in those communities. Baruch Hashem, bli ayin hara. We haven't seen outbreaks from them. But there are individual cases. And just because they're not getting sick and just because we're not seeing horrible things happening doesn't mean that we should ignore it. And certainly in communities like ours, where there isn't herd immunity by any level, and in communities where there's even less COVID than we had, and especially with people traveling from COVID areas to non-COVID areas or lower COVID areas, this is still a danger. B'li ayin hara, I've said this over and over again. Nothing would please me more a year from now that everybody points the finger at me and says, I was overly cautious and why did I make everybody wear a mask? Nothing happened. I would be the happiest person around. Honestly, I would be so pleased if I'm being overly aggressive. But if I save one life, Gemara in Sanhedrin tells us, if somebody saves one life, it's worth saving the entire world. I can pretty much guarantee that following my advice will save at least one life, if not many, many, many more.
You mentioned about flu shots. How soon should we be starting to take our flu shots?
So they're not available to my knowledge yet in any of the usual places that get it first, which is the Walmarts and the CVSs. The drugstores get it well before the hospitals. I would say as soon as it's available, people should take it. You don't have to run out to the store, and bang down an old lady in front of you to get a flu shot ahead of her. As soon as you can, once they're available, people should get them. It's not a rush to get it. Like if there was a COVID vaccine, I think people would be rushing faster than for the flu vaccine. Hopefully there will be a COVID vaccine and we should have that problem. But at the same time, people should make a major effort to make sure they get vaccinated against flu this year, and be Ezras Hashem, if and when we have a safe and effective COVID vaccine, I would be very, very quick to recommend that. Again, that's a big assumption that we have a safe and effective COVID vaccine. Be Ezras Hashem, we will, but we certainly don't have any guarantees that that will occur this year or even ever.
Are eyeglasses acceptable for teachers instead of face shields in order to protect their eyes?
So eyeglasses such as mine have nothing on the side. So it will not prevent something from going in from the side. So a goggle, which comes around like a sports goggle or just a regular, like a shield that the carpenters use or other people use when stuff could fly and hit their face. So those are fine. You don't have to wear a face shield. You're really protecting the eyes. Virus can be transmitted from a kid who is coughing or a kid who just has COVID and is asymptomatic, and it can get in your eye. We know how likely it is. People sometimes feel something coming after a conversation. Somebody put out a little phlegm or a spittle and goes into somebody's eyes. That is a way that COVID can be transmitted. But even if you don't feel something, there is in the air around somebody who's not wearing a mask the potential for COVID. So you're wearing a mask, you're covering your face and your mouth and your nose, but it still could go in the eye. Now, that's not enough of a reason if they're all wearing a mask. I don't wear an eye shield when I'm around somebody on the street. I'll put my mask on. But an eye shield, when somebody is not wearing a mask, is a reasonable thing for a teacher who's around a lot of kids. I don't recommend it for everybody, but for a teacher, a teacher teaching young kids in a preschool, so I think it's a very reasonable thing for them to wear.
Can you share with us the most recent data of COVID cases from the 5 towns or the Nassau County area?
Sure. So our hospital had a very slight uptick earlier in the week, and Baruch Hashem, it's back down to our standard 1 or 2 cases that we see new every day, sometimes 0, but usually 1 or 2 cases every day. The numbers for Nassau County, there is a little bit of an uptick in some communities in our neighborhood, but Baruch Hashem, overall, the numbers for the 5 towns and for some of the surrounding communities remain in the stable area, but not 0. There are cases every day in the 5 towns. That's the 5 towns. I'm not talking about some other place. There are new cases every day in the 5 towns. So Baruch Hashem, they have not led to huge outbreaks or problems. Baruch Hashem. There are about 40 to 60 cases every day new in Nassau County. I check this every day. We're running between 40 and 60. That's where it's plateaued.
You had mentioned in the past a super spreader. What is a super spreader, and what do we have to look out for?
So there's two ideas there. One is a super spreader, and one is a super spreader event. So the worst thing is to have a super spreader at a super spreader event. So the worst possible scenario would be for some, usually a teenager or a 20-year-old or a 30-year-old, to have gone to a party or to gone to a simcha, to gone to some camp or a school, and they have asymptomatic illness. They're not symptomatic, or they have very mild symptoms, and they actually have a large amount of virus coming out, and they can infect a lot of people. In some families, one person gets it. In other families, everybody gets it. And that probably has to do with viral load, how much virus is actually coming out, and other factors that we can't quantify. I heard a story, I don't know how true it is, that there was a family gathering of people, and almost every single person in that family gathering came down with COVID when one person had COVID. That's not the usual case, but that person is a super spreader. A super spreader event would be a kiddush, where everybody's wearing no masks, everybody's mingling together and talking together, and lots of potential virus coming out of everybody's mouth. To put a super spreader person at a super spreader event, a large gathering indoors of people without masks, so that's a perfect storm. And that's unfortunately called Purim. That's probably what happened back on March 9th and March 10th, with Purim being a perfect super spreader event, and there were unfortunately a lot of super spreaders. And that's why Nebuch, we saw such terrible, terrible consequences in our community. But not only in our community, this was seen from communities across the country. I'm involved in a paper that's going to actually show that. And these super spreader events are social cultural events. And then you have individuals that are very likely to spread at those events. That's a perfect storm. And that's the disaster we're trying to prevent by having people wear masks and social distancing. It's 10:30, so we'll stop now. B'ezras Hashem, I hope people take my recommendation from the Motzei Ephraim very seriously and start. You can start earlier, but start from Friday saying 10 kapitel of Tillim every day for the month of Elul. B'ezras Hashem, and that's zechus, and the zechus of all the people davening and improving themselves in Chodesh Elul. We should all have a good gebench jar, a kesiva v'chasima tova. Thank you very much for listening.
Thank you. Good luck to everybody. Thank you.